So somebody asked me the other day why I started posting the videos that I do on my TikTok. And for those of you that haven't seen my face before, I'm Kara. I'm an ultrasound tech in Canada. And the reason why I started posting the videos that I do was because, well, I guess two reasons. So, firstly, I did notice a huge gap in the way that our medical system is set up. I think just in the way that physicians oftentimes are not able to give the patients the time or I guess the quality of care that is needed in certain areas, ultrasound especially. I think that I have found in my almost 10 years now of being a sonographer that a lot of physicians don't really seem to know exactly what the best type of imaging is for the things that they are trying to find out about their patient. Also, it seems like a lot of them don't have a lot of time to be explaining things to the patient. Everything from how many scans they should be having in a pregnancy, why they're having the scans that they are getting, or even the fact that ultrasound does carry somewhat of a risk, even though the studies have shown that in the way that we use it, there have been no proven side effects that are negative. But still, the fact that ultrasound still has exposure risk to it, I think a lot of patients aren't educated on that side of things, and I totally get it. I would not want to be a physician. I obviously am so grateful that we have people who want to become doctors and who are going through medical school and dedicate all that time and effort to becoming a physician. But for myself personally, I'm like, no, I never wanted to become a doctor in the first place. And I have the utmost respect for them. Absolutely. And I also know how overrun most of them are. I know how full their days are, and there's simply just not enough time in the day to adequately answer all of your patients' questions, or even if they don't ask you questions, to be able to inform them about every single thing that they're going to get done and every single thing that is happening in their pregnancy. So, anyways, I guess the first reason is to hopefully just fill that gap between the patient going in for these exams, these ultrasounds that they may not necessarily know exactly what is happening with, and to, I guess, empower the patient to be able to know, okay, what is going on, or at least have somewhat of an idea for it. And the second reason why I started making videos is because after I came back to work after having our second child, I had the worst mom brain. Like, my body knew what to do, as in, I would be able to scan things like I did before pregnancy, before kids. But I guess a lot of the time I felt like I wasn't able to articulate as quickly as I wanted to on my worksheet as to what my impression of what was going on with the patient was. So I would be sitting there frustrated, asking my coworkers, okay, well, what is the medical word for this? Or like, okay, I see this in the patient. I just can't remember the word for it. And I kind of figured that if I was able to look up a lot of these things and teach them to myself and also make them in a video format, so actually saying it out loud after doing my research, it would probably make it stick a little bit better for myself. And also, I could then have a video reference for myself, even for all these conditions that we regularly come across, and basically just as a little refresher as well for myself. And I actually have found that at work, I'm a little bit more on the ball now with writing out my reports and knowing the medical terminology for everything now. It comes a little bit more easily to me. And maybe that is just because my kids are growing up now and my mom brain isn't as terrible in that aspect because I am getting more sleep. Things are more consistent now. But I also think it has a lot to do with making these videos and just making that content that you guys are wanting to know more information about. And therefore, it makes me go and research it. And then when I make a video on it and I'm able to do it in like a teaching style way, it sticks for me better. So I guess that in a very, very long winded way is for me to say that there are two reasons why I started making videos. Number one is just to bridge that gap for patients who are getting all of these ultrasounds or these tests done, and they may not know exactly why it is happening, or just for them to get a better understanding of what we are looking at. And number two, so that I can go ahead and learn more myself and solidify the information that I already know so that I can be a better sonographer myself and provide better care for my patients.